Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Evan back in here with us this afternoon for his sixth and final adjustment here. Evan came in here from Boca Raton, Florida on Monday, and he came in here complaining of neck pain, stiffness that radiated out into his shoulders, arms, and hands, low back pain, right leg pain, sciatica that went all the way down into his right bottom of his foot. That's the S1 dermatome. But he also had paresthesia, which is numbness and tingling down the L5 dermatome on his big toe, headaches, upper back pain, mid back pain, and lower thoracic pain. On Monday, we did his history and examination, and in doing his history and examination, I determined that he had biomechanical improprieties, which are called vertebral subluxations in the chiropractic profession, that alter a joint's normal state of function. So when it's subluxated, it's in an abnormal joint state of function, and it affects neurology and neurophysiology because of the impingement on the nerves being interrupted. Not where the vertebrae's out pinching on the nerve out of the IVF necessarily, but it is the neurophysiological sequela of the spine and the brain that changes a person's health and where they're feeling pain. You only experience pain in your brain. The only place that you can feel pain, literally, is in your brain. That's where pain is perceived. You might have pain in your leg, but it's only perceived in your brain. With the new research done by Dr. Heidi Horvick down in Australia, the Australian Spinal Research Foundation, she has been doing research which is really groundbreaking about neuroplasticity. Neuroplasticity is where the brain is constantly adapting to its environment, both externally and internally. So when we make adjustments to altered biomechanical improprieties or subluxations in the spine, we are affecting neuroproprioception that goes up into the brain afferently. The brain analyzes that and then sends down efferent neurological messages, pre and postganglionic, that filters out into the other organs, muscles, tissues, and cells. But she has shown through her research that we as chiropractors are affecting brain function, which is huge because that's what chiropractic started off talking about, is changing the nervous system function, which is what we do when we adjust someone. Evan came in with a myriad of different complaints, and he'd been Google doctoring it for a couple of years before he came here, so he kind of had himself talked into a bunch of different things.
Yep.
But I think we broke him of that, hopefully. But he's been here this week because I've been talking to him about it. Don't be your own worst enemy and Google doctor stuff and try to believe everything that you find on Google, because that's not necessarily the best answer for you. If you see a professional that's up to date on their scientific research and knows what's going on with patients' health by doing a thorough examination history and then a comprehensive treatment, which I think we've done a more comprehensive adjustment on you than what you've ever had, right?
Yep, 100%.
So, we'll show them how we did that. And did that answer your question too, Evan?
Basically, my issue was structural alignment within my body.
Biomechanical improprieties or subluxations in your spine and pelvis.
Spine and pelvis.
Which caused altered neurological function. That is your problem.
Yep, caused all the pain that I was feeling.
That you're perceiving in your brain.
Yep.
That's why I tell you your brain-body connection is really important, so don't talk yourself into hurting all the time. Because you know, the brain-body connection is huge. If you're telling yourself you're hurting here or hurting there, or this is killing me, this is killing me, this is hurting here, that's what's going to happen because your brain-body connection is very strong. If you say positive affirmations to yourself, I am healed, I am strong, I am stable, those kinds of things will also perpetuate themselves. So, we do physical, biomechanical adjustments in here, but we also acknowledge the power of the brain and the mind in a person's health, because that's a big deal. And sometimes people can go down these rabbit holes when they get to Google doctoring it too much and cause harm to themselves.
Yep, come in here and see him first. Don't Google everything yourself. It's a lot of work on yourself, but that's unnecessary.
Yeah, because you got into some pretty bad thinking processes doing all that, right?
Yeah, I mean,
you caused yourself to think you were having this and that and every other thing in the world.
Yep.
When you don't really know the science of it yourself, you're just believing what you found on Google. And a lot of people do that. It's not just Evan, but a lot of people in this country Google their symptoms and then try to go with that self-diagnosis, basically. The reason we do extensive, comprehensive medical histories and examinations, orthopedic neurological examinations, so that we can narrow down the problem. If it's subluxation or if it's not, or if it's pathology, we need to identify pathology as well, and we rule all that out right first visit. We ruled that pathology out on him.
Yep.
And we've been adjusting him every day since. And would you mind sharing with our YouTube audience how you've done over these past 3 days at twice a day? This will be your sixth and final adjustment, but tell them how you've done so far up to this point in time.
Yep. Just a lot of relief. The ring dinger is no joke. The posture, you could see it. It's just I feel much more aligned, and that's really what I feel. I feel a lot of relief. I thought that I had everything in the book just from searching things on Google and feeling the pain. You think that you have this and that. Coming in here gave me a sense of clarity on what I have, a biomechanical, structural, out of alignment, misalignments,
subluxations.
And I just found a lot of relief coming here. I'm glad that I came here sooner than later, and it's just been a lot of relief.
Well, you've all heard me say this a zillion times on my videos. Posture is a mirror of spinal biomechanics. When he came in on Monday, check out his video on Monday that we did. And then today, look at the difference in how he's standing up. He now has level x-axis, neutral y-axis, because we've taken that compressive stress off his spine with the ring dinger, and z-axis is neutral too. He's not rotated on the z-axis. He's standing up like a military man right now. And that's natural. You're not trying to do that, right?
Nope.
So look at his posture first thing Monday, and now take a look at this one today, and you'll see the difference biomechanically. And that's really what our job as chiropractors is supposed to do. We're affecting biomechanical alignment or configuration of the spine, and then that enhances neurophysiological function. So chiropractic truly is neuromusculoskeletal, and I told you that this morning. We talked about that.
Yep.
You have three components going on: skeletal, muscles and ligaments that are responsible for holding it there, and then you've got the neurological consequences and sequela of the subluxations or misaligned biomechanical improprieties. So it is neuromusculoskeletal in nature. That's what we've been treating since 1895 with D.D. Palmer, adjusting the first patient back in Davenport, Iowa. And that's what we continue to do today. If you're going to a chiropractor 3 times a week for months on end, and you're just getting roller tables and E-stem and hot packs and therapies, and they're not adjusting your spine, my personal and professional opinion is that's a betrayal of the actual chiropractic model, because we were trained to diagnose and treat neuromusculoskeletal issues on patients, and that's what we stick to in here. You don't see me doing any therapies. I haven't pushed any vitamins on you this week or tried to sell you anything, have I?
Nope.
The only thing we're selling in here is my hands and these adjusting procedures, and people can see for themselves just from watching our videos if that looks something like they benefit from. And that's what you originally found us on YouTube, right?
Yep.
And are you getting what you saw in the YouTube videos? Are you personally getting that done to yourself?
100%.
Yep.
Everything is what you see is what you get.
That's right. Now, I say that a lot too, because they always say, oh, he does the same procedure on everybody. Well, yeah, I do, because it works. So you can say that he does the same thing on everybody no matter what their diagnosis. But yeah, I'm ruling out pathology. I'm ruling out other altered physiological sequela that could be causing his issues. And we're narrowing it down to neuromusculoskeletal. And once we've done that, we put him in mirror images and adjust his spine and pelvis in a mirror image on the XYZ axes, so that we can get him neutral x-axis, y-axis, and z-axis, and that's what we're going to show you right now. Let's go ahead and flex your head forward and backwards for me again, Evan. Now, this was a whole new experience for you this week, wasn't it, Evan?
Yes, sir.
Okay, let's do this one here first. Okay, slide up that way just a little. The worst part of this whole thing is the pins. You hip source.
A little
the
bit.
Pins work. Yeah.
It's worth it for the ring dinger.
Yeah, it is. That's the worst part of it for me too, is the pins. But these are like 20th generation pins. These are my soft, cushy ones compared to the wooden pegs I used to use. You'd have been diving out that 10th floor window to get that. There we go. Okay. You want to keep your teeth together, Evan. Just keep breathing through your nose. Don't bite your tongue. There you go. Perfect. I've been hitting homers all day. All week, actually. Felt that one all the way down, didn't you?
Yes, sir.
And looky there, you're still kicking.
Oh.
Tilt left. There you go. Tilt right. Perfect. That was adjusting his cervical spine on the Z-axis and the Y-axis. This was a straight Y-axis adjustment, the ring dinger. Manual spinal neural decompression adjustment on the Y-axis is the official name for the ring dinger. Let me help you up. Sideways. There you go. I'm going to come over here on your tummy next, Devin. See there? She's exactly even now. That tighten up any, Evan?
Not really.
Okay, good. Your right leg got a little shorter when I brought it up, so it still tells me you got a little bit of subluxation in this right SI joint. Left SI joint. Center triangular shaped bone is called the sacrum. I'm adjusting that straight superior to inferior away from L5. L5 straight P to A. L4 straight P to A. L3 straight P to A. L2 P to A with a inferior to superior line of drive. And then L1, same thing. There you go. Yes, sir. Let's see if it stays even this time. Yep, it does. That's better. Does that feel easy?
Yes, sir.
Good deal. Good. Okay, let's turn you on your back, please. Okay, slide down this way a little bit. There you go. Good. Now let's have you put both arms out, palms facing up. Slide down this way a little bit. A little bit more. Slide down a little bit more. There we go. Okay, you can relax your hands right there. Yes, sir. I'm decompressing him for both ends. He looked any taller to you this week?
Yeah.
Plus he's standing up straight too, huh? All right, let's have you sit up and face toward Jessica. There we go. There we go. There.
So much more relaxed.
Yes.
Just after.
Yeah, getting adjusted. It's because it's calming your nervous system down, so it's functioning the way it's supposed to, as opposed to being in hyperdrive, fight or flight. I'll stand you over here in front of the mirror. Doesn't get much better than that, Evan. these guys here. There we go. Okay. Now try that same thing again.
Much smoother.
Yes, sir. So I always ask this question on the last visit of the day. Evan, if somebody in Boca came up to you and said, okay, you went and saw Johnson 6 times over the last 3 days on a 0 to 100% scale, and let me write my number down first. How much improvement would you say you've received in your overall benefit this week on a 0 to 100% scale?
10 out of 10. 10 out of 10.
100%?
100%.
I put 90, so I'm usually within 10%.
I'm standing up straighter.
Well, you're functioning better too.
Yep.
You're able to walk around without so much pain now all the time, right?
Yes.
And you're thinking clearer.
Much more thinking clearer.
What would be the biggest benefit that you would share with our YouTube audience about your visits here this week? What stands out to you about what you've done here this week the most?
Just a lot of relief. Just thinking more clear from his diagnosis, what he has told me, and just what I feel. I just feel much more relief. In tune with the body. I'm standing up straighter. I mean, if you see the first video, I'm sure you could see it. Yeah. I'm just standing up straighter and
breathing easier.
Taking
in more oxygen.
Yes, sir. When you're in pain, it's hard.
It affects everything.
It affects everything. So putting one positive thought, I know I've been there. I felt so much relief here. I wouldn't wait to come in here. Putting one positive thought in front of another and just keeping it rolling.
Yep, great. Well, it's been an honor for me to help you this week. Thank you for sharing your experience with everyone.
Yes, sir.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Evan from Boca Raton, Florida. We'll see y'all soon.